Housecall Providers has always had at its core mission to serve populations whose needs are not being met. Whether it's been originally the frail elderly or now with our advanced illness care program around populations that are experiencing serious medical illness, life-threatening illness, and having a variety of social needs. Whether or not someone has lived a very difficult life and is homeless, or someone is a 35-year-old mom with 3 children and working, our program is designed to meet all of those needs and meet those people where they are. Housing, food insecurity, caregiving needs, social isolation. That's the beginning of the therapeutic relationship, by seeing the patients as equals and not needing their lives to be fixed, but to be supported by us. The kinds of things like being homeless or having different types of social problems are not a barrier to providing this care, and that everyone deserves dignified end-of-life care and palliative care when they're experiencing serious illness.
A couple of years ago, I was really sick. Endocarditis, HIV, actually I was dying of AIDS, and I didn't know where to go. I didn't know the questions to ask, who to talk to. I was homeless. I was on the streets. I didn't really do anything to help myself. Being sick just kind of came with the territory until something really bad happened. And you were so sick like that you couldn't walk, and that's where I was. And since the team came into my life, I have been able to have my heart surgery. I've been able to get clean. I've been able to continue taking my meds. My HIV levels are non-detectable. They've truly helped me just work through this whole process. I don't know where I would be without them.
I see lives change, and I see outcomes change, and it's a miracle.
My son asked me to please get better because he didn't want me to die, that he wanted me to be around, he wanted to get to know me. Even though I'd let him down his whole life, I didn't want to let him down anymore. I didn't want to die a drug addict. It wasn't just me now, it was them. And so I kind of had my family and my team really to help me wrap their arms around me, I guess, until I could wrap my own arms around myself, till I could love myself.
I can only say my life's been a whirlwind. It's been ups and downs, more downs than ups. I was homeless. I was sleeping in doorways, and it's cold outside, and I gotta find somewhere to eat. I go to the hospital, they said the next time I have any drug reactions, I might lose my kidneys, I might have to have dialysis, and that's what happened. When I go take the treatment, and they sucking my blood, I'm pushing it back in and everything. I don't know if anything may happen while I'm on this machine, and I'm very scared of that. Monica, she took a little bit of the sting away. She got this big old smile on her face, and it disarmed me. She talked to the doctors to make sure that the type of treatment that I'm getting is the treatment that I should be getting.
What I enjoy most about this work is the fact that I get to work one-on-one with these patients. I get to spend the time that they need to develop that relationship. We basically become family. Sandy was one of our first patients on the Advanced Illness Care Program. We built a relationship quickly with her after multiple hospitalizations that she had.
My heart, it doesn't pump out. My heart doesn't, and it's getting worse. And there's nothing that can be done. It just has to be taking care of myself with my medications and not holding on to any of the luggage that makes me sicker. One night I was in my room and I thought to myself, my God, I don't want to die. You know, I've got some stuff to do yet. I find with Mel and Brenda, I can talk about that stuff, and I had secrets that were eating me up alive, you know, and I told them. And it was hard for me to tell them because I haven't completely forgiven myself for them, but they forgave me. And I told them so they weren't mine anymore to hide. The more I told them about myself, And the more we shared about each other's things, they became closer and closer to me. I realized that, dying wasn't an option for me yet. My youngest daughter passed, and I was able to cope better with her loss because of them. When you have all these things, not just your health, but everything else coming down around you, plus the death of a child, you can't take that stuff away, but you can put it where it belongs. And you don't have to have it all on one plate. And that's what they helped me do.
I was born with a Morphan. I'm more susceptible in getting aneurysms. The last one was 3 years ago. The doctor, he fixed it, but then on the way out, he bruised the lower spine. I can't walk. I can feel it, but I can't move it. I'm just afraid that if I have another big operation, I maybe a quad or even worse is a coma. I'd rather just live the life I have, and who knows. My team is Monica and AC, and I told the family what I want to do, and some of the family just apparently didn't want to hear that, so they called Monica, and she calmed them down. It's nice to have one of those voices. I don't know where I would be if it wasn't for them.
When you've had negative experiences in the medical community or the community at large, it's often difficult to find your voice or speak up or trust. Advocating is a passion of mine. It's really going in and being a voice for a patient, helping them to have their own voice and know their rights and choose the options or the care that they want to have.
I was released from Coffee Creek. I did about 2.5 years, and I was released with stage 4 cancer. So the morning I woke up, I found out that I had no housing. It fell through. I'm walking through the gates, just thinking, what am I gonna do? Where am I gonna go? And I'm just thinking, I'm gonna die on the streets. I'm looking at my spiritual mom, and I had to tell her that my housing fell through and that I need help. Since moving to Rose Quarter Compass Oncology and meeting the advanced care team, I got a scooter, I got a wheelchair. They've fast-tracked, it seemed like, everything since I've had them. I felt like alone when I was in prison. I didn't have adequate health care. Now, if I need something, I can call one of the Housecall Providers. I finally got my own apartment. I get my keys on Monday at 2. I'm just really excited that I'll have more independence. I'm still fighting cancer. They gave me a time frame. My goal is to live as much as I can, but beat that.
We know that everyone walking into our program does not fit into one pattern or one model. And this goes back to why ACE has different disciplines in the team, why we think of each patient as the beginning of a story. And that is the strength of our program, is that by starting with a patient's needs and meeting them where they are in their journey, we're able to walk with them in whatever is needed going forward.